Hey, stop right there. Before you click away, I want you to think about something for just 10 seconds. You woke up this morning, and the first thing you felt, before your feet even hit the floor, was that familiar ache. Maybe it was your knees, maybe it was your hips, maybe it was your fingers, stiff and swollen like they belonged to someone twice your age, and you thought to yourself, again, there has to be something I can do about this. And then maybe you went to the pharmacy, or maybe you went online, and you were completely overwhelmed. Glucosamine, collagen, fish oil, turmeric, chondroitin, MSM, boron, hyaluronic acid. Every single bottle promises to be the answer. Every single label says, supports joint health. Every single price tag makes you hesitate. So you either bought everything, or you bought nothing. I've been a physician and researcher for over 50 years. I've spent my career looking at what the science actually says versus what people want the science to say. And I'm here today to cut through the noise, the marketing, and the wishful thinking, and give you the honest truth about these supplements. I'm Dr. Anthony Fauci, and in the next 20 to 25 minutes, we are going to go through every major joint supplement you've heard about: glucosamine, collagen, fish oil, and several others. And I'm going to tell you exactly what the research shows, exactly who it helps, exactly who it doesn't help, and exactly what I would tell a patient sitting across from me in my clinic. No sponsorships, no bias, just science. Here's what you're going to learn today. First, we're going to understand why joints hurt in the first place, because if you don't know what's happening inside your body, no supplement is going to make sense. Then we're going to go one by one through the most popular joint supplements, look at the clinical evidence, the real studies, the randomized controlled trials, and I'm going to give you a straight verdict on each one. We're also going to talk about who is the ideal candidate for each supplement, whether there are safety concerns, and finally, I'm going to give you my personal recommendation, the combination approach that has the most scientific backing right now. This is going to be the most comprehensive, honest breakdown of joint supplements you'll find on this platform. Let's get into it. Section 1. Why do your joints hurt? Understanding the battlefield. Before we talk about solutions, we need to talk about the problem. Because joint pain is not one thing. It's several very different things happening for different reasons, and that matters enormously when we're choosing supplements. The most common cause of joint pain in adults over 40 is osteoarthritis. Now, most people think osteoarthritis is simply wear and tear, and while that's partly true, it's actually a much more complex disease. Here's what's really happening. Your joints are lined with cartilage, a smooth, rubbery tissue that acts like a cushion between your bones. This cartilage doesn't have a blood supply of its own. It gets its nutrients from the synovial fluid, the fluid that lubricates the joint. When cartilage breaks down faster than it can repair itself, bones start to grind against each other. That grinding causes inflammation. That inflammation causes pain. And over time, it causes more cartilage damage. It's a vicious cycle. Now, inflammation is actually the key word here, because when you understand that joint pain is fundamentally tied to inflammation, you start to understand why certain supplements work and why others don't. The second major cause of joint pain is rheumatoid arthritis, and this is fundamentally different. Rheumatoid arthritis is an autoimmune disease where your immune system mistakenly attacks the lining of your joints. This is important because supplements that work for osteoarthritis may have no effect whatsoever on rheumatoid arthritis. There are also other causes: gout, bursitis, tendinitis, and joint injuries. And today we're going to be focusing primarily on osteoarthritis because that is what affects the majority of people watching this video. Okay, now that we understand what's happening inside the joint, let's look at what people are trying to do about it. Section 2. Glucosamine, the most studied supplement on the market. Let's start with glucosamine because it has been studied more extensively than almost any other joint supplement. And the results? Well, they're complicated, which is exactly why I want to spend real time on this. Glucosamine is a naturally occurring compound in your body. It's a building block of cartilage. The idea behind taking it as a supplement is simple. If your cartilage is breaking down, maybe flooding the system with more building blocks will help rebuild it. Sounds reasonable, right? Here's what the research actually shows. The most significant study on glucosamine was the GAIT trial, the Glucosamine/Chondroitin Arthritis Intervention Trial, funded by the National Institutes of Health. This was a large, well-designed, double-blind, placebo-controlled trial involving over 1,500 patients with knee osteoarthritis, and the results were sobering. Overall, glucosamine did not significantly outperform the placebo in reducing pain. Now, and this is crucial, there was a subgroup. Patients with moderate to severe knee pain actually did show a statistically significant benefit from the combination of glucosamine and chondroitin, not glucosamine alone, the combination. So what does this mean for you? It means that if you have mild knee pain, glucosamine alone is probably not going to change your life. But if you have moderate to severe osteoarthritis of the knee, the combination of glucosamine and chondroitin sulfate may genuinely help. Now, there have also been European studies, particularly the LEGS trial and some Swiss research, that have suggested glucosamine sulfate may actually slow the structural progression of osteoarthritis. Meaning, it might not just reduce pain, it might actually slow the breakdown of cartilage. That is a very significant claim, and the evidence is suggestive but not yet definitive. My verdict on glucosamine. It is worth trying if you have moderate to severe knee osteoarthritis, particularly in combination with chondroitin. Give it at least 3 months before you judge whether it's working. The standard dose studied is 1,500 milligrams of glucosamine sulfate per day. And importantly, if you're diabetic, talk to your doctor first, because glucosamine can affect blood sugar levels. Section 3. Chondroitin, glucosamine's partner in crime. Chondroitin sulfate is almost always discussed alongside glucosamine, and for good reason. They work through related but distinct mechanisms. Chondroitin is another naturally occurring compound in cartilage. It draws water into the cartilage tissue, giving it that cushioning, shock-absorbing quality. It may also help inhibit enzymes that break down cartilage. The research on chondroitin alone is mixed. When you look at studies independently, some show modest benefit in pain reduction, others show little effect. But here's the interesting thing. The combination with glucosamine has consistently shown better results than either compound alone. One European study specifically looking at chondroitin found that it reduced joint space narrowing over time, which is a structural measure of osteoarthritis progression. That's significant. You're not just treating symptoms, you might be altering the course of the disease. The recommended dose is 800 to 1,200 milligrams of chondroitin sulfate per day. It's generally very well tolerated. The main consideration is sourcing. Chondroitin is typically derived from animal cartilage, so if you're vegan or have shellfish allergies, you need to read labels carefully. My verdict on chondroitin. Combined with glucosamine, this is one of the better supported supplement combinations for knee osteoarthritis. Take them together, not separately. Section 4. Fish oil, an anti-inflammatory powerhouse. Now we're getting into one of my favorite topics, because the research on fish oil for inflammation is extensive and actually quite compelling. Fish oil contains omega-3 fatty acids, specifically EPA and DHA. These are anti-inflammatory compounds, and since joint pain is fundamentally an inflammatory process, this makes biological sense. Here's what the research shows. Multiple randomized controlled trials have demonstrated that omega-3 supplementation reduces inflammatory markers in the body, including markers specifically associated with joint inflammation. Studies have shown that fish oil can reduce joint stiffness, decrease the number of tender joints, and in some cases reduce the need for NSAIDs. Those are your ibuprofen-type medications. A particularly interesting area of research involves rheumatoid arthritis. Unlike glucosamine, which has questionable evidence for rheumatoid arthritis, fish oil has shown genuine benefit across multiple studies in RA patients. Not as a replacement for medical treatment, let me be very clear about that, but as an adjunct, as something that genuinely complements conventional therapy. For osteoarthritis, the evidence is somewhat less dramatic, but still supportive. The anti-inflammatory effect is real, and it extends beyond joints. Fish oil has robust cardiovascular benefits, which means you're potentially getting multiple returns on your investment. Dosing matters here. Many people take fish oil at ineffective doses. The studies showing joint benefit typically use doses of 2,000 to 3,000 milligrams of combined EPA and DHA per day, not total fish oil, but the active omega-3 components. Read your label carefully. A standard fish oil capsule might contain only 300 milligrams of EPA and DHA combined. You may need to take several capsules to reach a therapeutic dose. The main side effects are a fishy aftertaste, which you can minimize by taking it with food or choosing enteric-coated capsules, and at high doses, a very slight increase in bleeding time, which matters if you're on blood thinners. My verdict on fish oil. This is probably the supplement I would most universally recommend for joint pain, because the evidence is strong and the benefits extend beyond just the joints. If you're only going to take one thing on this list, fish oil deserves serious consideration. Section 5. Collagen, the new darling of the supplement world. Collagen is everywhere right now. It's in powders, drinks, capsules, and skincare products. And when it comes to joints, there's actually some legitimate science here, although it may not work the way the marketing suggests. Your cartilage is largely made of collagen, specifically type 2 collagen. So the thinking is, if we take collagen supplements, they'll go into our joints and replenish the collagen there. Now, here's where we have to be careful, because this is an area where the marketing often outpaces the evidence. When you swallow collagen, whether it's a powder or a capsule, your digestive system breaks it down into individual amino acids and small peptides. It doesn't go directly into your joints as intact collagen. Your body decides what to do with those amino acids. So why are there studies showing collagen supplements help with joint pain? Two reasons. First, certain collagen peptides, particularly a type called undenatured type 2 collagen, or UC2, appear to work through an immune mechanism. They may actually help modulate the immune response that drives joint inflammation and cartilage breakdown. This is different from simply providing building blocks. Second, hydrolyzed collagen, the most common form in supplements, provides high concentrations of glycine and proline, amino acids that are important for collagen synthesis in the body. So while the collagen itself is broken down, the raw materials it provides may support the body's own collagen production. Several randomized controlled trials have shown that collagen supplementation reduces joint pain scores and improves function. A study published in Current Medical Research and Opinion found that athletes taking collagen hydrolysate had significantly less joint pain during activity compared to placebo. However, I want to be honest with you. The collagen supplement industry is large and commercially driven, and some of the studies have been funded by supplement manufacturers. That doesn't make them wrong, but it does mean we should look at the evidence with appropriate scrutiny. My verdict on collagen: promising, especially for active individuals with exercise-related joint pain. UC2 in particular has interesting immune-modulating evidence. I would not rank it as strongly as fish oil or the glucosamine chondroitin combination for osteoarthritis, but it is a reasonable addition to a joint health regimen. Typical dosing is 10 to 15 grams of hydrolyzed collagen per day or 40 milligrams of UC2. Section 6. Turmeric and curcumin, ancient wisdom meets modern science. Let's talk about turmeric, and more specifically, its active compound, curcumin. This is one of the most researched natural anti-inflammatory compounds in the world. Curcumin works by inhibiting several inflammatory pathways in the body, including NF-κB, which is a master regulator of inflammation. This isn't herbal mythology, this is biochemistry, and the research is genuinely impressive. A systematic review published in the Journal of Medicinal Food analyzed multiple randomized controlled trials and found that curcumin supplementation significantly reduced pain and improved function in patients with osteoarthritis. Several studies have compared curcumin directly to ibuprofen for knee osteoarthritis and found comparable pain relief with significantly fewer gastrointestinal side effects. Now, the elephant in the room with curcumin is bioavailability. Curcumin is notoriously difficult for the body to absorb. If you just eat turmeric powder, very little curcumin makes it into your bloodstream. This is why formulation matters enormously. The most bioavailable forms include curcumin combined with piperine, that's black pepper extract, which increases absorption by up to 2,000%, phospholipid complexes like Meriva or curcumin, and nanoparticle formulations. When you're buying a curcumin supplement, look specifically for one of these enhanced formulations. Plain curcumin or plain turmeric powder has very limited absorption. My verdict on curcumin: one of the most evidence-backed natural anti-inflammatory agents available. The research is solid. The key is bioavailability. Spend the extra money on a formulation designed for absorption. This is one I genuinely believe in. Okay, we are halfway through, and I want to make sure you stay with me, because what's coming in the second half is, honestly, more important than what we've covered so far. We've looked at the popular supplements, but there are two things most people never hear about that I think deserve serious attention. One is an herb that has some of the strongest anti-inflammatory evidence I've seen, and the other is a compound your body makes naturally that declines dramatically with age and may be the missing link in joint health. And then at the very end, I'm going to give you my actual protocol, the combination I would recommend to someone walking into my office right now, with doses and timing. Don't go anywhere. Section 7. MSM, the overlooked compound. MSM stands for methylsulfonylmethane. I know, not exactly a catchy name, which is probably why it doesn't get the attention it deserves. MSM is an organic sulfur compound found naturally in small amounts in foods. Sulfur is an essential component in the structure of cartilage and connective tissue. MSM also has direct anti-inflammatory and antioxidant properties. Several clinical trials have shown that MSM supplementation reduces pain and improves physical function in people with osteoarthritis. A double-blind, placebo-controlled trial published in Osteoarthritis and Cartilage found that 3 grams of MSM twice daily, so 6 grams total, significantly reduced pain and improved physical function compared to placebo over 12 weeks. It's also frequently combined with glucosamine and chondroitin, and there's evidence that the combination is more effective than any single compound alone. What I find appealing about MSM from a clinical standpoint is its safety profile. It is extremely well tolerated. Very few side effects even at higher doses. My verdict on MSM: underrated and undersupported, but the evidence is genuinely solid. If you're building a joint supplement stack, MSM at 3,000 to 6,000 milligrams per day is a worthwhile addition. Section 8. Boswellia, the herb the research is excited about. This is the one I promised you earlier, the herb with some of the most impressive anti-inflammatory evidence I've come across. Boswellia serrata, also known as Indian frankincense, contains compounds called boswellic acids. These acids work by specifically inhibiting an enzyme called 5-LOX, or 5-lipoxygenase. This enzyme is responsible for producing a class of inflammatory compounds called leukotrienes, which play a major role in joint inflammation. What makes Boswellia interesting is that it targets a different inflammatory pathway than most anti-inflammatory compounds. NSAIDs like ibuprofen primarily target the COX pathway. Fish oil and curcumin broadly reduce inflammation. Boswellia specifically targets the leukotriene pathway. Multiple randomized controlled trials have shown Boswellia extract to significantly reduce knee pain, improve joint function, and increase walking distance in patients with osteoarthritis. One study in the journal Phytomedicine showed significant improvement within just 7 days of starting Boswellia, one which is remarkably fast for a supplement. A particular extract called AKBA, acetyl 11-keto-beta-boswellic acid, appears to be the most potent compound. Look for supplements standardized for AKBA content. My verdict on Boswellia? This has some of the strongest clinical evidence of any herbal supplement for joint pain. It is fast-acting relative to other supplements, has a distinct mechanism of action, and is very safe. This is one I would genuinely recommend. Section 9. Hyaluronic acid, from injections to pills. You've probably heard of hyaluronic acid injections for knee pain. Doctors have been injecting it directly into arthritic knees for years, with mixed results. But what about oral hyaluronic acid? Hyaluronic acid is a major component of synovial fluid, the lubricating fluid in your joints. As cartilage deteriorates in osteoarthritis, the quality and quantity of synovial fluid declines. So supplementing with hyaluronic acid seems like a logical approach. The evidence for oral hyaluronic acid is more modest than for injections, but it's not zero. A Japanese randomized controlled trial found that oral hyaluronic acid supplementation improved knee function and reduced pain in patients with mild to moderate knee osteoarthritis. Other smaller studies have shown similar modest benefits. The challenge with oral hyaluronic acid is, like collagen, whether it survives digestion and actually makes it to the joints. Emerging evidence suggests that some hyaluronic acid peptides do reach joint tissue through the blood, but this area of research is still developing. My verdict on hyaluronic acid: interesting science, modest evidence, not something I'd put at the top of a joint health protocol, but not something to dismiss either. If you have mild to moderate knee pain and want to try it, 80 to 200 milligrams per day is the typical dose used in research. Section 10. Vitamin D, the joint supplement nobody talks about. Here's one that might surprise you: vitamin D. We know that vitamin D deficiency is extraordinarily common, especially in people who live in northern latitudes, who spend little time outdoors, or who are older. And there is a significant and consistent association between vitamin D deficiency and joint pain. Multiple observational studies have found that people with osteoarthritis tend to have lower vitamin D levels, and that low vitamin D is associated with faster cartilage loss and more rapid disease progression. But here's where it gets nuanced. When researchers have done randomized controlled trials giving vitamin D supplements to people with osteoarthritis, the results on pain reduction have been mixed. Some trials show benefit, others don't. However, Where vitamin D is clearly essential is in supporting the underlying musculoskeletal system. Vitamin D is critical for calcium absorption, bone health, and muscle function. If you're deficient in vitamin D, your entire musculoskeletal system is compromised, and no amount of glucosamine is going to compensate for that. My recommendation? Get your vitamin D level tested. If you're deficient, which is very common, supplementing is important not just for your joints, but for your overall health. Most adults benefit from 1,000 to 2,000 IU of vitamin D3 per day, though some people require significantly more. My verdict? Not a direct joint pain treatment, but an essential foundation. Consider this non-negotiable if you're deficient. Section 11. What doesn't work? Let's be honest. I've told you what has evidence. Now let me be equally honest about what doesn't. Shark cartilage. This was enormously popular decades ago, based on the reasoning that sharks don't get cancer, so their cartilage must be protective. There is no credible scientific evidence that shark cartilage supplements benefit joint health, or cancer for that matter. Additionally, the harvesting of sharks for this purpose is environmentally destructive. Many proprietary joint blends in commercial supplements are what we call fairy dust formulations. They list impressive-sounding ingredients, but the doses of each individual ingredient are far below what any clinical trial has shown to be effective. The label looks great, the science doesn't support it. Generic, undifferentiated turmeric powder without an enhanced absorption system. The curcumin content of turmeric is only about 3%, and plain curcumin has poor bioavailability. Plain turmeric powder as a supplement is not the same as a standardized, bioavailable curcumin extract. And finally, let me address the elephant in the room. No supplement will replace a damaged joint. If you have severe osteoarthritis with significant cartilage loss, you are dealing with a structural problem. Supplements can support joint health, reduce inflammation, and potentially slow progression, but they cannot rebuild cartilage that is already gone. Section 12. The role of lifestyle, supplements can't do it alone. I want to step back for a moment, because if I talk about supplements without talking about lifestyle, I'm not giving you the complete picture. No supplement is going to overcome the damage done by a chronically inflammatory lifestyle. I'm talking about excess body weight, because every extra pound of body weight translates to approximately 4 pounds of additional force on your knee joints. Weight management is not just cosmetic, it is genuinely therapeutic for joint health. Exercise is also profoundly important. I know it seems counterintuitive when your joints hurt, but low-impact exercise, swimming, cycling, walking, actually improves joint health. It stimulates synovial fluid production, strengthens the muscles around joints, and reduces inflammation. Anti-inflammatory diet matters. A diet high in ultra-processed foods, refined sugars, and trans fats drives systemic inflammation, including joint inflammation. A diet rich in vegetables, fruits, fatty fish, olive oil, and whole grains has the opposite effect. Sleep is often overlooked. Inflammatory cytokines are regulated by sleep. Chronic sleep deprivation increases inflammation throughout the body. I raise all of this not to lecture you, but because I've seen too many patients spend significant money on supplements while ignoring the lifestyle factors that would deliver 10 times the benefit. Supplements are adjuncts. They work best in the context of an overall healthy approach. Section 13. Safety, interactions, and who should be careful. Before we get to my protocol recommendation, I want to address safety, because some of these supplements are not appropriate for everyone. Glucosamine and chondroitin. If you are on the blood thinner warfarin, there are case reports of interactions. Monitor your INR if you start these supplements. If you are diabetic, glucosamine may affect blood glucose control. Discuss with your physician. Fish oil at therapeutic doses can have a mild blood thinning effect. If you are on anticoagulant medications, warfarin, aspirin, clopidogrel, discuss with your doctor before taking high-dose fish oil. Curcumin at high doses may increase the risk of kidney stones in susceptible individuals. It may also interact with blood thinners and certain chemotherapy agents. Boswellia is generally very safe. No significant interactions are well documented, but as always, disclose to your physician. If you are pregnant or breastfeeding, discuss any supplements with your obstetrician before starting. If you have a medical condition or are taking prescription medications, the rule is always the same. Tell your doctor what you're taking. Supplements are not harmless just because they're natural. They are biologically active compounds. Section 14. My clinical protocol. What I would actually recommend. This is what you've been waiting for. 50 years of clinical experience and research distilled into what I would actually tell a patient. For most adults with mild to moderate osteoarthritis of the knees or hips, here's the evidence-based foundation I would start with. First, high-quality fish oil, providing 2,000 to 3,000 milligrams of EPA plus DHA per day. Take it with your largest meal to enhance absorption and reduce any GI discomfort. This is the most universally beneficial supplement on the list, with benefits that extend well beyond joints. Second, glucosamine sulfate, 1,500 milligrams, combined with chondroitin sulfate, 1,200 milligrams, taken daily. This is specifically for people with moderate to severe knee osteoarthritis. Give it 3 months minimum before evaluating efficacy. Third, a bioavailable curcumin formulation. Look for Mariva, curcumin, or piperine-enhanced curcumin, standardized to at least 95% curcuminoids, at a dose of 500 to 1,000 milligrams per day. Fourth, Boswellia extract, standardized for AKBA content, at 100 to 400 milligrams per day. This one works relatively quickly and has strong evidence. Fifth, MSM at 1,500 to 3,000 milligrams twice daily, especially if you're building a comprehensive stack. Sixth, get your vitamin D level checked. If you're deficient, correct it. Now, I am not suggesting everyone needs to take all 6 of these simultaneously. Start with fish oil. Add glucosamine chondroitin if you have significant knee pain. Add curcumin and boswellia if you want comprehensive anti-inflammatory support. And please, choose quality supplements. Third-party testing matters. Look for certifications from NSF International, USP, or Consumer Lab. The supplement industry is not as regulated as the pharmaceutical industry, and quality varies enormously. Section 15. The honest truth about expectations. I want to close with something that I think is important and that too few people say. Supplements for joint health are not magic. They are not going to eliminate severe pain overnight. They are not going to reverse established arthritis. And they work best, and I really cannot emphasize this enough, when they are part of a comprehensive approach that includes appropriate exercise, weight management, a healthy diet, adequate sleep, and regular medical care. What the best supplements can do, and there is genuine evidence for this, is reduce inflammation, support cartilage health, slow disease progression in some cases, and meaningfully improve quality of life. I have seen patients who came to me bent over with joint pain, who, through a combination of weight loss, physical therapy, and the right supplement protocol, regained a significant amount of their function and quality of life, without surgery, without opioids, through smart, evidence-based choices. That is what I want for you. The goal is not perfect joints. The goal is to live your life with as much comfort, mobility, and independence as possible. And armed with the right information, that goal is far more achievable than most people realize. So let's bring it all together. Glucosamine and chondroitin, together, for moderate to severe knee osteoarthritis, not separately. 3 months minimum to judge results. Fish oil, broad anti-inflammatory benefit, cardiovascular benefit. Dose to the omega-3 content, not the total oil volume. Collagen, promising, particularly UC2 form and for exercise-related joint pain. Turmeric and curcumin, strong evidence, but bioavailability is everything. Don't just buy turmeric powder. Boswellia, underrated, fast-acting, different mechanism, worth serious consideration. MSM, solid, safe, underappreciated. Vitamin D, get tested. Correct deficiency, this is foundational. And please remember, lifestyle matters more than any supplement. Move your body, manage your weight, eat anti-inflammatory foods, sleep. If this video gave you clarity, if it helped you understand which supplements are worth your money and which ones aren't, then I've done my job. Now I want to ask you something. If you found this valuable, please subscribe to this channel. Click that subscribe button right now, because this is what we do here. We look at real science, we cut through the noise, and we give you the honest information you need to make better decisions about your health. I also want to hear from you. Have you tried any of these supplements? What has worked for you? What hasn't? Leave your experience in the comments below, because your story might be exactly what someone else needs to hear. And if you know someone dealing with joint pain, a parent, a friend, a partner, share this video with them, because this information is too important to keep to yourself. I'll see you in the next video. Take care of your body. You only get one.